We talked about the importance of having a specific set of diagnostic standards and sticking with it. I don't like exceptions, but I'm going to talk about exceptions in this video. The exception would be if you are new to a practice or a new dentist in general. When working with dentists, I have been fairly surprised at how poor their communication skills are. I assumed the dentist could read a room, could recognize when somebody believed them or didn't believe them. I thought general tact was a fairly common skill, but I was quickly proven wrong after hiring associates. This is one of the examples of things that they don't teach you in dental school. If you haven't worked a customer service job or worked around a lot of people, then I guess I kind of understand, but you have to deal well with people. Everything is about relationships, and dentistry is no different. To accept treatment, patients have to trust you. You need to establish trust. There is a bit of stigma that dentists overdiagnose and try to create a bunch of work. There also is a stigma depending on how the doctor looks. We can beat around the bush, but if a dentist looks young or is a lot younger than the patient, that can be a potential reason for distrust. If the patient is a different nationality or has an accent or vice versa, there is a potential for that to cause trust issues. I know that isn't politically correct to say, but it is a reality that you have to recognize. If you go to a rural practice full of cowboys and you come in acting like you're from the city, the same thing applies. If something is new or different, it can tend to decrease trust. I'm not saying that different people can't be trusted. I'm saying that you'd have to be dumb to not recognize this reality. If a 40-year-old dentist leaves a practice and another 40-year-old dentist that is similar in mannerisms takes their place, then clearly that is significantly different than a retiring doctor who is older and patches everything being replaced by a doctor fresh out of school and modern and fairly aggressive in his treatment. Clearly, there are going to be trust issues. So as a dentist, you need to recognize this reality and approach your communication accordingly so that you can build trust over time with patients. The more different you are than the doctor you are replacing, the more you need to be aware of that. From the way they talk, from the way they diagnose, the way they do the exam, the flow, and everything related to it needs to be studied and mimicked. Obviously, if they have bad habits, there are things you're not going to want to copy. But as much as you can, emulate the prior doctor to make the patient experience as familiar as possible. It will only be to your benefit. The other interesting principle is that if you do the same thing as someone else, but get a different result, people will not trust you. If a patient has been coming to the practice for 10 years, every 6 months, and never had a cavity, and then you come in and diagnose 6 cavities, guess what? That person is going to be skeptical and not trust you. You need to be aware of this. There are plenty of strategies and ways that you can build trust and avoid these issues. This does not mean to be afraid to diagnose, but you have to approach things the right way. Whenever I take over a practice, especially from a doctor who does a lot of underdiagnosing and patchwork, I make sure to invest in some type of technology or process that clearly demonstrates I do things differently than the prior doctor. Let's say the doctor had old film x-rays, which is less common these days. I would make sure to get digital x-rays in there. If there is ever any doubt or question, and I'm in a situation where I diagnose more than I think the person would be expecting, I mention, yeah, these new x-rays are a lot more sensitive and can see a lot more than the old x-rays. If they already have had digital x-rays, I might try getting a Diagnodent or some type of transillumination or maybe an oral camera that helps with caries detection. As long as you are doing something different, it will help patients understand and not erode that trust. Let's talk about some of these situations. Let's say you have a new patient today. One of the questions I will always ask a new patient is, how long has it been since you've been to the dentist? Why am I asking that? Because I'm trying to understand their expectations. If they have not been to the dentist for quite a while, they are expecting things to be found. They already know that they've been bad and have already been thinking worst case scenario. If they say this, then it's a green light to diagnose the same way you would for everyone and not be too concerned. If they say they're every 6 months for the past 10 years, then that is very different. I will then ask, oh, if you don't mind me asking, why did you leave that office? They left for a reason, and hopefully they're saying something like the dentist retired, but if not, they should give me some good clues about what I can't do in the future to mess it up. If they say there was a billing issue or whatever caused them to leave, I will make that note and we will try hard to never repeat that issue. For a patient like this, if you find a bunch of work and they haven't had anything for years with regular dental visits, they are probably not going to stay. For someone like this, if there are major problems with their work or significant decay, I have to get really tactful in how I approach this. If it's a bunch of smaller things, then I will just have the conversation and say something like, now this is our first time meeting, so I don't have years of history with your x-rays, but I am noticing a number of small cavities that are starting to show up on our digital x-rays. I'm not sure the dentist before had this high quality of x-rays, so it's possible they weren't showing up before. I don't know if these have been here a long time and haven't gotten bigger, or if these have just been developing since your last visit. If it's okay with you, I would like to revisit these at your next cleaning and take new x-rays to see if this is something that we need to fix eventually. There may be a couple you have to do now, but as a whole, this approach works great. You have primed and prepped that patient and have basically been given permission to do those fillings the next time they come in. I would rather wait 6 months and preserve this new relationship and have a patient for life than lose them after this appointment. Obviously, if it is anything significant, you have to act sooner, but just the fact that you're taking and showing a cautious approach to the patient will alleviate trust issues, and they will actually appreciate the honesty. When you get a patient from another dentist, you will likely find all sorts of things. Be careful not to judge that dentist because you were not there and you don't understand the situation. The patient might have been diagnosed but never paid for any of the work and didn't get it done. Remember, never throw the other dentist under the bus or karma comes back to get you. If it is an existing patient and you are new to the practice, then you need to be cognizant of that patient's history. You should try and have an idea of what every patient expects. You can get the hygienist help by prepping you with certain things. The hygienist can be used to ask things like, have you met this doctor before? To give you a heads up if they haven't met you yet, or did they have any concerns? Your hygienist can look through the notes and help make sure there weren't any watches, areas, or issues flagged previously. They could take a look and help you figure out if this person has been very diligent with their home care and visits. The more diligent and consistent someone has been in coming, the more suspicious they will be if you see a bunch of fillings or need to diagnose more work. You can still do it, but you have to do something different than the dentist before you is done. Also, when you're talking to a patient, you can read their emotions. If they are really shocked, concerned, or freaked out, then communicate appropriately, calm things down. And if they need to wait a little bit for treatment, that's okay. You are here to work with people and help people. Freaking patients out and making them leave doesn't help anyone. So try to have a basic idea of a patient's expectations before you walk into a room. If a patient tells the hygienist they have pain and multiple concerns, they are not going to be nearly as distrustful if you find something. Little by little, you will find what tactics are helpful and ways to communicate that will help the patient get the care they need diagnosed and the treatment completed. The other thing that is important to talk about is urgency. I can think of very few new hires that get urgency correct right away. I find that most dentists are not urgent enough. They are not confident and very wishy-washy with the things they say. Patients will leave an appointment often not 100% sure if they have to fix the fillings or crown or not. Dentists do not convey confidence, and it leads to lots of work not being done. Then sometimes you get a dentist that is on the opposite spectrum, who makes every situation the end of the world if the treatment is not done that very moment. Certain things are urgent, and it's important to be very clear and direct about the needs and what you are expecting the patient to do. However, applying too much urgency comes off very poorly. I prefer our doctors to be calm, clear, and direct. If a patient asks if they have to do this now or wait 6 months, I would say, if it were me, I would absolutely do this as soon as you are able to. Right now, I know we can fix your tooth and it will work well, but the bigger this crack or cavity gets, there's no guarantee or no promise it could lead to more expensive treatment. We just don't know. All I can tell you is that if we fix it now, I'm confident we'll have great results. This still conveys urgency, but not in a crazy, off-putting way. And it will probably take some time, but when you're diagnosing fillings, you just need to practice. When something doesn't work, or you leave a conversation and think, that was quite awkward, figure out what you did and try to improve it for the next time. Whenever something goes wrong, make note of what the patient asked and what you said, and figure out how to do it better the next time. If you don't know, then ask your assistant or hygienist. I bet they'll tell you. Sometimes having a third party and getting their opinion makes all the difference. Ask them, hey, it felt like that patient didn't really understand what I was saying. How do you think we could have done better to communicate this? Your team will appreciate that they value your opinion, and they might actually give you a great answer that you didn't notice. Let's talk briefly about second opinions. When someone comes to you for a second opinion, let's say they bring x-rays and a treatment plan, and they tell you the previous dentist diagnosed 15 fillings. They're really looking for you to tell them the other dentist was lying. That's what they actually want from you. This can be very tempting for some doctors who might try to gain a patient by telling them exactly what they want to hear and throwing the other dentist under the bus. If you tell the patient the other dentist overdiagnosed and that they only need a few of those fillings, chances are you'll get the patient. However, I think that's the wrong thing to do. You should never be in a position where you need a patient so badly that you resort to being slimy and undercutting others. Occasionally, you might find yourself in a situation where, yes, maybe you would have only diagnosed 4 or 5 of the 15 fillings. Even then, I still won't throw the other dentist under the bus. Instead, I explain that cavities are a spectrum and a process, not a black and white thing. Every dentist is a little bit different in deciding when to treat a cavity, whether it's very early or later in the caries process. You can then explain your philosophy, how you approach these decisions, and why you would diagnose 5 fillings in this case. You may still get that patient. You'll have done it in a way that respects the fact that dentists are different and not one is right and one is wrong. I believe this is the better way to handle it, and hopefully you'll earn the patient's trust because you're clearly communicating the truth. Any dentist who throws another dentist under the bus, especially when it's not warranted, is frankly dirty. I have no respect or patience for those dentists, and I don't want anything to do with them. If you're willing to belittle someone else to get ahead, that speaks volumes about your character. And if you've done it before, learn from it and make sure you don't do it again. Now, let's talk a little bit about the situation where you're a new dentist in a practice and you start doing exams. You begin to find cavities and other problems that clearly should have been resolved, but weren't. If you're taking over for a doctor who is no longer there, do your best to not throw that dentist under the bus or belittle them. I focus on getting things right now rather than dwelling on past wrongs. I don't even bring up or plant the thought in the patient's head that the prior dentist may have done something shady. The truth is, we don't know the full story. I've seen cavities grow quickly and things change rapidly, so we can't always know the prior situation. In fact, I can count on one hand the number of times I've needed to involve a prior doctor regarding treatment. There are rare cases, such as those involving high liability risks or significant financial implications, where it clearly needs to be addressed. In those cases, I would ask the patient to return and in the meantime, consult the previous dentist. The last thing I want to do is say or do something that might escalate the situation into a lawsuit. If you've ever been involved in one, you know that stress is something nobody needs. We should be helping other dentists avoid that, just as we would hope they'd help us in return. The reality is that if everyone is reasonable and works together, almost all situations can be resolved easily and amicably. On that note, when you're taking over for another doctor or buying a practice, it's critical to make sure your contracts clearly outline how to handle past treatment issues. Don't leave out any details or situations. Doing so will save you a lot of stress in the future. Now, let's consider the same scenario, but this time the previous doctor is still in the practice, such as in a group setting. In this case, your first priority should be to diagnose the situation correctly and get the work done. If the patient has concerns or the situation is complex, quickly involve the other dentist and consult with them to find a solution. Be quick to collaborate and very slow to form opinions or judgments. Frankly, you're not smart enough and you don't know enough to judge others quickly. Focus on working together to provide the best care for the patient. Let's say you're working in a group practice and you have some gaps in your schedule. You decide to look at the charting for upcoming patients. I can't tell you how many times I've seen doctors take a quick glance at an x-ray, not immediately see a cavity, and jump to the conclusion that the other dentist made a mistake. Before you know it, they've already made a judgment, marched into the room, and told the patient there was an error, that they don't actually need a filling. They make a whole thing out of it. However, clinically, there was decay. It just wasn't easily noticeable in the usual way. Again, be slow to judge. If you really can't find an issue, ask the diagnosing dentist to help you see where the cavity is. Don't approach them by saying, hey, you diagnosed a filling, but there's no cavity there. Instead, ask for their perspective. Can you show me what you're seeing here? Always aim to learn, not judge. I almost never tell a patient there is no cavity there because the last thing I want to do is undermine the trust in another dentist. If the diagnosing dentist isn't available, I might reappoint the patient with the dentist to complete the fillings. Alternatively, I might take a conservative approach by suggesting we monitor the area with fluoride treatment and see if we can avoid doing the filling. I'll try a variety of strategies to maintain trust and keep a positive relationship with the patient. While errors do occasionally happen, most of them are due to miscommunication. An assistant or a front office team member transposing information incorrectly. For example, it does happen, but it doesn't mean the dentist is bad or wrong. Approach these situations with care, professionalism, and a commitment to collaboration. Another thing I often see is doctors diagnosing fillings when a patient has a cosmetic concern or issue they want improved. Fillings are meant to fill holes in teeth. They don't typically make teeth look better. If a patient's primary concern is cosmetic, you probably shouldn't be recommending fillings. For anterior teeth, you should consider options like veneers or crowns, ideally involving a wax up as part of the planned process. And of course, you should be charging appropriately for these treatments. When a patient has cosmetic expectations, there's a high likelihood that a filling won't meet those expectations. The younger and less experienced a dentist is, the less they seem to realize this. That's not to say there aren't situations where a filling can achieve the desired aesthetic result, but if a patient has cosmetic concern, a red flag should go up. This typically indicates they need something more comprehensive than just a filling. This topic could probably be an entire course, so I don't want to go too crazy into this right now, but when you're diagnosing fillings, you need to also learn to read the room. If you get good at this, your patients will never be blindsided, and you will actually build trust as opposed to diminishing it. Thank you for making it to the end of this video, and I'm excited to get deeper into this topic. Let's work together to make dentistry more fun, rewarding, and fulfilling. Don't forget to subscribe and stay tuned for more.